Hello, this is
Hello.
Dr. Trivedi.
Yes, doctor.
Hello, yes, this is Dr. Trivedi, a doctor working in this clinic. May I confirm your name and age, please?
My name is Selena Gomez and I am 31 years old.
Okay, how may I address you?
Please call me Selena.
Okay, Mrs. Selena, today we are going to discuss about your health issue. Is that all right?
Okay, doctor, I have no problem with that.
Okay, and during our discussion, I might take down some notes which will be strictly confidential. Is it okay with you?
Totally okay, doctor.
Okay. Now, Mrs. Selena, can you please tell me in your own words what have brought you here today?
Yes, doctor. For last 2 days, I noticed that I have got swollen of my left leg, and initially I thought that it will go away, but it is not going away, and rather it is increasing. And also, I feel some pain in my leg that has made me somewhat worried. And for that, I visited my GP, and he said that soiling of one leg is something suspicious. So he sent me here.
Okay. Okay, Mrs. Selena, we'll try our level best to find out what's troubling you. Well, you told that, did this problem come along all on a sudden or did this come along gradually? Can you please tell me?
I think suddenly, doctor.
Okay. And how up in the leg has this spread, this swelling?
Uh, about to leg. Actually, up to the
Okay,
knee. About up to the
up to your knee.
yes, doctor.
Okay. And what about your right leg? Is it all right?
I have no problem with right side.
Okay. Okay, that's all right. That's all right. And okay. And have you felt that has it been the same since for the last 2 days, or is it increasing?
It is increasing.
Okay. And okay. And can you please tell me that um, is there anything that makes you feel better now?
No,
Okay. Anything that makes it worse?
I haven't noticed.
Okay. And you told that there is also some pain. Am I right?
Yes, doctor. Some aching and some
Okay.
tingling, some numbness on my leg.
Okay. Something. Okay. For how long has it been present?
For last 2 days.
Or last week. Okay. At this moment, may I ask you some questions? So that did you had any trauma uh, in these last 2 days? Before this last 2 days?
No,
Okay. Any raised temperature in your body?
no,
Okay. Well, have you noticed in any redness in your left leg in these 2 days?
no, no,
Okay. Any raised temperature in your leg? Have you noticed any?
no. Whether it is
Oh,
cold somewhat.
it's somewhat cold. Okay. And okay. May I ask you some other questions now? That do you do you have any chest pain?
No, doctor.
Okay, any shortness of breath?
No,
Hello.
no, no,
Okay. Any cough? Have you noticed?
no,
Okay. Any racing and have you ever coughed out blood?
no,
Okay. Any racing and pacing of your heart?
no,
Okay. Do you have any headache?
no, doctor.
Okay. Any changes in your mood?
No,
Okay. And any vision problem?
no.
Okay. Any rashes anywhere in your body?
I had rashes, doctor, all over my face. That is not present for last 1 month, but it was a problem for me before.
Okay. Can you please tell me for how long has had this been present? This rash?
About 3 months.
About 3 months. Okay. Could you tell me about its color? What color was it?
Reddish.
Okay. Was it itchy?
No,
Did it ever bleed?
no.
Okay. Did it ever get worse or better? Have you noticed anything?
Doctor, I took some cream over the counter, and they
Yeah.
see. their steroid cream, and that made it disappear.
Okay, that made it disappear. I can get it. And well, could you feel that going to sunlight made it worse?
Yes, doctor.
Could you feel?
Yes, doctor.
Okay. Okay, okay. Well, it's actually a personal question, but can you please tell me that have you experienced any hair fall?
No, I cannot.
Okay, that's all right. That's all right. Well, may I ask you some other questions now? Do you have any oral soreness?
I had before, doctor, that comes on and off.
Have you ever sought any medical attention for that?
No, I just take some what the counter medication, some mouthwash. That helps.
Yeah, yeah. Okay. Have you ever noticed any dry eyes?
No,
Any dry mouth?
no.
Okay. And any joint pain?
Some achiness over my joints of my hands, but that
O-
goes away after taking paracetamol.
Okay. For how long have you been facing this achiness?
Maybe for last 6 months.
Okay. Have you ever noticed any redness or swelling in your
No,
hands, in your joints? Okay.
no,
And have you ever noticed any changes in the shape of your hand joints?
no.
Okay. Well, have you ever noticed that were there any morning jamming present or not
Sometimes,
in your
doctor.
hand? Okay. For how long did it persist if there was any morning jamming present?
Maybe for half an hour to 1 hour.
Okay. And have you noticed that there was anything that made it worse
No,
or made it feel better?
no,
Okay. And okay, that's all right. And may I ask you that did you ever had any weakness in any parts of your body?
no.
Okay. And what about the water work?
I think it's
Has
fine.
it? Okay. Have you ever passed out any blood in your water work? Have you noticed
No,
any frothiness in your water work?
no,
Any pain while doing your water work?
no.
Okay. And how about your bowel movement?
I think it's fine.
Okay. And have you ever noticed any change in your bowel motion, bowel habit?
No,
Okay. Any bleeding any times from your bowel?
no,
Okay. And that's all right. And may I ask you some other questions now? That uh, have you ever had any previous medical history, any known disease?
no,
Okay. And any history of blood clots previously?
no,
Okay. And do you have any significant family history of any known diseases? Have you noticed known any?
no,
Okay. Any family history of blood clots?
no,
Any family history of sudden death?
no.
Okay. And may I know that what medications do you take?
I take some paracetamol tablet when I feel achiness of my pain. Nothing else.
Okay, some paracetamol tablets. Okay, and any allergic to any medication?
No,
Any over the counter medication?
no.
I'm sorry to ask, it's a personal question, but may I proceed?
Okay.
Have you ever taken any recreational medication?
No,
Okay, and any blood transfer, any medication through your blood channels or any blood
no,
transfusion?
never.
Okay, that's very good. That's all right. And may I ask you some other personal questions now?
Okay.
Do you drink alcohol?
No.
Okay, that's very good. Do you smoke, Mrs. Gomez?
Yes, doctor. But only five
How
or
many?
six sticks a day.
Okay, may I ask you for how long?
Maybe for about 15 years.
Okay, actually, smoking is very hazardous and can contribute to your symptoms as well. So I would like you to stop smoking, and if you want, we would refer you to smoking cessation clinic. Will that be all right?
Okay, doctor.
Okay, and may I ask you some very personal, private questions at this moment? May I proceed? Actually, these are very personal questions. May I
Okay,
ask?
doctor. I have no problem with that.
Okay, okay. May I know that whom do you live with?
My husband.
Okay, and have you ever tried to have any babies? May I know?
No, doctor.
Okay, that's all right. That's all right. And may I know that do you take any medication so that you don't get so that you don't conceive?
Yes, doctor.
Okay, and may I ask you for how long have you been taking this?
Uh, that is for about 10 years.
Okay, okay, that's all right. And may I ask you how about your period?
It's regular.
Okay, that's all right. And that's all right. I'm actually very sorry to ask these questions. And now may I ask you some other questions now? That may I know what do you do for a living?
Office clerk, doctor.
Okay, and do you think that your symptoms are problem causing problem to your job now for the
Yes,
last two
doctor.
days?
For last 2 days, I couldn't attend the job because there's the achiness, some pain that made me somewhat feel
Yeah, yeah,
discomfort.
yeah. I can get it. And may I know that have you had any operations recently?
No.
Okay. Have you been to any travel recently to any other places?
Yes, doctor. I went to see Egypt about 2 weeks ago. We were there
Okay.
for about 4 days.
Okay. So you came back around 10 days back.
Yes,
Okay. May I know that how did you go there by flight or something like that?
flight.
Okay. And was it a long haul flight?
It was about
Uh,
6 hours long journey.
okay. Okay. And may I know that do you have any loss of weight recently?
No,
Okay. Any weather
made very
preferences? Okay. Any
no.
weather preferences? Okay. Any? Okay. That's all right. And may I ask you? Uh, may I ask you that what are your concerns at this moment?
Why I am having this, doctor? My CP said that they can be somewhat suspicious. So it's a very serious condition.
Yeah. Well, at this moment, at this moment, actually, you have we at this moment we cannot be completely sure about what's causing you, but we have some suspicions, and we have that there can be some clotting in your blood channels in the leg. Okay, but we have to be sure by doing examinations, by examining you properly, and also doing some blood tests and some scanning of your legs and chest as well. But in the meantime, so that you don't get worse, we will give you some medication. Okay, some blood thinning medication in the meantime, and also we will involve a multidisciplinary team consisting of occupational health services and um, um, also blood channel specialists, blood specialists, medicine specialists. Okay, so that they can take care of you. We will also help you with your job so that it can be better. We will also try to give you some pain medication so that you can feel better of your pain. And there can be some more issues as well, like at times we suspect that the medication you take for not getting conceived, they can contribute to this type of condition. However, uh,
Time
we will
up.
review. Yeah. Any other concern?
Time up.
Okay. Now I will actually now want to do examinations. Will that be okay?
Okay.
Yeah. At the beginning, I will have a I will try tell the patient to please expose her legs, is if it's okay.
Okay.
Okay. And then I will have want to have a look at both legs. Any redness, any swelling present or not?
Left leg is swollen.
Swollen. Okay. Which part more?
Below, including the calf and below.
Okay. Then I will touch both legs to see whether any raised temperature present or not.
No.
Okay. Just any tenderness present or not.
Yes.
Okay. And now I will also like to feel the pulses peripheral, like arteria dorsalis pedis and anteriotibial nerves, tibial
Present.
artery.
Present.
Hello.
Present.
Hello.
Yes, I can hear you.
Okay, present. Okay, and then yeah, I would like to do the plantar response.
Pleasure.
Okay, and now I would like to I would like to have a look whether there is any skin infection present in the legs or not.
No.
Okay, and now I would like to have a look at his face whether there is any residual rashes present.
Yes.
Okay, and I will have to look at her eyes to see any anemia present or not.
No.
Okay, look at his mouth for oral soreness.
No.
Okay, and then I would like to feel the base of his lung, of her lung.
Clear.
Okay, and also the specifically apex of the heart and both apex of the lung and apex of the heart both.
Apex is clear.
Okay, and just I would like to have a look at her hands also, whether there is any deformity present or not, and just quickly examine the joints whether they're painful or not.
No.
Okay, and I think that's the examination part.
Okay. So, have you reached your diagnosis?
Uh, I think that the patient, I might not have reached the diagnosis. I have actually have missed one important question. However, uh, I think that I have quite reached the diagnosis that it might be DVD, most probably uh, associated with uh, SLE. Okay, secondary due to antiphospholipid syndrome due to SLE. I think it would be my prime diagnosis, and I might have some differentials here. Like it can be cellulitis, it can be. I think it can be just. Sometimes I think sometimes I think some gravitational edema can also take place. I'm not sure about it, and I have actually missed a question which I have asked that since she has went to Egypt, whether there was any tick biting present or not. I think I mixed any biting of insects or something like that. So I think that could have also been a cause.
Okay. How to investigate her?
Yeah. First of all, I would like to do some baseline investigation like complete blood count to see whether there is any anemia or any evidence of infection by seeing neutrophil count, and also the lymphocyte count, whether any lymph obstruction or any lymphatic involvement is present. Then I would like to do inflammatory markers like ESR and CRP to rule out any infection again, and then I would like to do D-dimer level. Okay, and D-dimer level, and then I would like to do some specific tests for like Doppler ultrasound of both lower legs and also CTPA or VQ scanning. CTPA means CT pulmonary angiogram or ventilation perfusion scanning, and then to rule out SLE, I would like to do some blood tests like doing anti nuclear antibody, then also anti-DS and double stranded DNA antibody, and anti-Smith antibody, and then urine microscopic examination, urine culture and sensitivity, and urine protein creatine ratio, albumin creatine ratio, and I think these are the and also chest X-ray PA view and ECG and echocardiogram. I think these all will be needed, and also yes, I think these are the most important tests.
Okay. Then I am coming to the history taking. The history taking was swelling on the left leg. For that, you have asked the site involvement and then onset when it started. How did it started? Did it started suddenly or gradually? Is it increasing or remain static after the onset, and after that character, you have asked about the character if it is presented with signs of inflammation or not. That was fine. And with radiation, it is increasing up to the knee, or it is increasing. You have asked, and then associated, and for associated you haven't asked any neurological symptoms of the leg, any rheumatological condition of the leg. You have asked about skin of the legs, but later stage. You have excluded cellulitis. You haven't excluded white infection. You have excluded the history of trauma. Okay.
Yeah,
After
yeah,
after that, yeah, with associated symptoms, as you are suspecting, it is a case of deep vein thrombosis with associated other conditions. You have asked for. You've tried to find out other associated condition, and a systemic approach. You have asked it at a very later stage.
yeah, yeah, yeah.
And then timing, is it improved in the morning or not? Then eliciting factor, aggravating factor, then severity, how is it is affecting her daily condition or daily life. That was good. And whenever you came to a diagnosis of deep vein thrombosis, you have asked about the complication of deep vein thrombosis. You have tried to find out the cause of the deep vein thrombosis. That was fine. And after that, in the history, in the past history, I've asked that well. Drug history, I've asked well. I cannot remember. You have asked about family history, any
Yeah, yeah,
history of similar condition in the family, any history of clot disorder, or any history of problem in with blood clot in their family, any history of cancer in the family. Sometimes some occult cancer can present with DVT.
yeah, 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 yeah.
And for the red flag symptoms, you haven't asked any weight loss, night
I
sweats,
like actually.
lumps or bumps,
Yeah, yeah, yeah,
in focal neurological signs. Okay.
yeah, yeah.
Then
I need night nothing.
personality, you have asked about smoking, alcohol. Then you have asked about the job. You have offered the social healthcare support. That was fine. Should have asked about also the home support if she needs any. And
Yeah,
also
yeah.
driving, you haven't asked it. Travel history, you have asked it if for travel, if she had taken any precaution after the travel, and if uh, she had traveled before and had developed any skin condition like this.
Mm-hmm.
Okay.
Mm.
And
Yeah,
also there were that is something that your diagnosis was deep vein thrombosis. There are certain risk factors, like it can be a case of due to prolonged immobilization from the flight, can be caused by oral contraceptive pill. You have asked about the oral contraceptive pill. That was fine. Then
yeah,
can also be secondary to systemic lupus erythematosus, and there was no component of antiphospholipid syndrome as far as I can remember.
yeah, yeah, yeah.
Okay, and there are also certain
Mm-hmm.
other familial conditions that can contribute, like some abnormal floating disorders like von Hippel syndrome,
Yeah,
uh,
yeah,
polycythemia, some of
yeah, yeah, yeah,
cancer. Okay,
yeah. Okay, okay.
in the investigation, you should have also mentioned
May I ask
something like
one thing that how should have I told the diagnosis that I think this is a case of DVT, most likely associated with long haul flight or
deep vein thrombosis on left leg, and there are certain risk factors. These are this. Okay, I will have
okay,
to
okay,
rule out by investigation, and your investigation should include all the possible diagnoses, including the familial conditions like uh, familial polycythemia, then thrombocythemia, then von Hippel-Lindau syndrome, then protein C resistance, protein S resistance.
Yeah. Okay.
Okay, fine. Thank you.
Okay.